Hi, my name is Nicole Werner, and I'm going to walk you through a radial arterial line for the Surgery Olympics. We're going to be doing it with an ultrasound, so you're going to want to get your linear probe. And then to place the catheter, we're going to be using an arrow kit, which is typically what we use in the ICU in the emergency department, where there's a needle, a catheter, and a guide wire all in one. And so the first thing I do is I start up and drape, and then you're going to place some surgical lube on the field. I've already done this. And then the first thing I do is I try to identify the artery. And so you can see there's a lot of structures. Sometimes the tendons look like artery, but you really want to find the structure that's pulsating. That means your vessel is patent. I put it right in the middle of the screen, and on our screen we have that nice little center line that helps keep you honest, because then on your probe there's a black line, and if you put your needle in line with the black line on your probe, then they all should be direct. And I'm inserting at a 45-degree angle. You can see my needle tip starting to come into the field there. That's that bright white dot. I'm directly over the artery. I'm going to push down, and I should see a flash into my catheter. Yeah. It's a little subtle on these models, but there is some flash there. Then what I'm going to do, I drop the ultrasound probe, I lower my hand, and I'm going to advance the guide wire using this black portion, which pushes the guide wire out. Once the guide wire is fully extended, I stabilize the rest of my hand, and I slide the catheter over the wire onto the guide wire into the artery. I carefully hold the catheter in place as I remove the guide wire, and then I should get some back bleeding, which you can see here. Plug it with your finger, or you can hold proximal pressure until you can get an A-line setup secured. The other thing we should talk about is how to secure this arterial line. On your sterile field, you should have a needle or a needle driver and a suture. And typically you just need one suture to hold this in place. And on the catheter itself, there's a little groove, and that's exactly where you want your suture to go. When we don't secure the catheter, they're a lot more prone to falling out, and the readings become less accurate.